Hello everyone, I'm Dr. Kyla from Effingham Pelvic Health and Wellness. Today I'm going to talk you through how to activate and how to find your transverse abdominis muscle or your deep core. So this is one that we use a lot in the clinic, so make sure first before trying this at home that you have practiced this with your pelvic floor therapist. It's really important that you get a professional to be able to make sure that you're activating the right muscles and that you're coordinating the right things before trying these at home. So here we have Emma. She is going to be my model today. So she is going to help me as I walk you through trying to activate this muscle and find the correct muscle at home, okay? So first thing a pelvic floor therapist will do when you come in is we're gonna try to find the muscle for you. So usually you can find your hip bone on the sides of your hips here, and then you just kind of drop inwards a little bit to where it's soft. That's right where that transverse abdominis muscle lays, so it connects hip bone to hip bone. So what you're gonna do is you're gonna take that nice deep inhale, and then when you go to exhale, think about bringing your belly button in towards your spine. And you should feel that muscle kick on underneath of your hands. Hold it through your exhale, and then release. And then you'll do a nice big inhale again. When you go to exhale, bring the belly button in towards the spine, tighten up that lower core, and then release. So to do this at home, take your hands, find your hip bones. So I'll let Emma find her hip bones there. She's gonna drop in just a few inches to where that muscle is kind of soft. There shouldn't be any bone or anything underneath of there. She's gonna do a nice big inhale. When she goes to exhale, she's gonna try to bring that belly button in towards her spine, and she should feel that muscle tighten underneath of her hands. It's a very small contraction, so they call it like a butterfly's heartbeat. It's very little, that muscle is very small. So if you're feeling a big contraction or you're seeing anything in the abdomen move, anything above the belly button move, you're probably activating too much of the muscle. If you're feeling anything in the lower back or is activating any pain in the back, you're also probably doing too much with this core. It's a very small muscle, it does not take a lot, so think about less is more with this contraction here, okay? Continue to coordinate that motion with your breath. So on the exhale, it should always be tightening as you exhale. Once you get a little bit more advanced in this exercise and your therapist approves you to do it, you can also add in a Kegel with this one as well, or a pelvic floor muscle contraction. So you would do a nice deep inhale, and then when you go to exhale, you're gonna bring the core down towards your spine, and you're also gonna squeeze that pelvic floor like a Kegel. So you can work on the coordination of doing all of that together as well. Make sure with that step that your pelvic floor therapist has approved you. Sometimes it's not appropriate to be doing Kegels, so we don't want you to do those if you don't need to be doing those. But that's how you put them into this exercise if it were okay for you to do that. So again, we'll do it one more time. You're gonna do a nice big inhale, and on that exhale, bring the belly button to your spine, tighten that lower core, hold it through the exhale, and then release.